Hello, everyone. Thank you for joining us again for another Code Blue series, Trauma-Informed Care and the Impact of COVID-19. January is National Human Trafficking Awareness Month, and we're taking this opportunity to really help educate the community about an issue that is oftentimes really not discussed. It's something that we know exists, but we don't really know a lot about it. When we talk about being trauma-informed, it's very important that we provide and have a sense of what it takes to serve these individuals in a way that is very efficacious and addresses their needs. We're joined today by two frontline workers that come with a wealth of experience in this area. First, we have with us Ms. Hannah Halbreich, who is with Catholic Charities, as well as Jasmine Morales with Fair Girls. So I'd like to start out by first and foremost thanking you ladies for joining me today. And just to get a little bit more information and background about your organizations and the work that you're doing there. Starting with you, Hannah.
Sure. So I'm the program manager at Catholic Charities for the Trafficking Victims Assistance Program. And we work with domestic and foreign-born survivors of trafficking, adults and children. And primarily what the program does is we provide comprehensive case management and support services. So when a client comes to us, we make sure that they get all of the things that they need, such as housing, food, clothes, some of the basic necessities. And then we also connect them to medical, dental care, mental health services, attorneys, education, employment services, and a range of other referrals so they have what they need. And we serve clients for really as long as they need services, and work with them individually on their goals so they're able to get the resources and the skills and the support to be successful and live independently.
Okay, great. Thank you. And Jasmine, tell us a little bit more about what's going on, what you do at Fair Girls.
Yeah, so
This is actually about.
Yeah, I'm the Outreach and Prevention Education Specialist.
Sorry, I missed that. Could you say it again, please?
Oh,
okay. That was my phone.
Oh, no worries.
Start over. I'm sorry.
No, you're all good. I'll try again.
Okay, so we'll cut that. We'll cut that. And my apologies. I just turned it off.
No worries. I can just.
So Jasmine, if you could tell us a little bit more about Fair Girls and the work that you're doing there with survivors of human trafficking.
Yes, of course. Thank you. So I'm the Outreach and Prevention Education Specialist. Our organization as a whole provides intervention and holistic care to survivors of human trafficking who identify as girls or young women. So we have direct services such as case management. Our very dedicated case managers work with survivors on both short-term and long-term goals, whether that is any mental health services that they're looking for. Our case managers are able to connect them with that, whether that's legal services or other medical services, or, if they are looking to get back into the workforce, get back into school, our case managers work very closely with survivors to meet their goals, like I mentioned, both long-term and short-term. And in addition to our case management services, we also have a transitional home, our Vida home, which is our safe home for survivors ages 18 to 26. While at the home, survivors have access to, of course, the basic needs, such as food, care items, and all those essentials, as well as transportation and the case management services. And in addition to those direct services, we also have our prevention education and policy advocacy, in which we work to inform the community on risks of trafficking and advocate for survivors. In addition, Fair Girls work to eradicate human trafficking and create brighter outcomes for survivors.
So clearly, both of you and your organizations are doing a lot of much needed work in the field. Here at the Family Justice Center, we also serve the population of survivors, I should say, and you are our partners, and we make those referrals to you. But one of the things that we've known and have really been struggling with is the fact that most survivors of human trafficking do not self-identify. And it's sometimes very difficult to even recognize during the intake process that this is someone who has potentially been trafficked. What are some of the challenges that you have faced, and how are you able to maintain the relationship with your clients to keep them there? Because obviously you're providing a wealth of resources, things that they clearly need. How are you able to keep them there to build that trust and to help them understand that there is another way to life beyond living with the trafficking? Hannah?
Yeah, so I think one of the challenges in terms of your question, Denise, is reaching a range of populations of individuals who identify. And like you said, most of the clients we work with don't really have an understanding of what trafficking is. They don't self-identify, or they've really never heard of it. So when we do an intake, we ask a range of questions in a trauma-informed way as much as possible to get to know our clients. And we also spend the time to really get to know each individual before determining eligibility. So we have a 6-month window of determining whether the client is a survivor of trafficking or not, because that is the requirement for our program. So we have some time to build rapport and get to know them, their needs, who they are, while we're learning about their story, what they've experienced. And in terms of the population that we work with, we definitely see more women, and we are referred minors as well. But as we know, for social services in general, men are less likely to come forward and to seek services. And we also don't have any male staff members at the moment. So most providers in the DC area are comprised mostly of women, which is great, but we also can't always offer the same services or exactly the same thing for men that we can for women. We have a women's group. We would love to have a group for men, but we're not at the spot yet that we have a male staff member. So I'd say that would be one of the challenges, and to keep clients coming back to services, and also from returning to a trafficking situation. I think it's a lot about building this trust and this relationship between the case manager and the client, but also an understanding that everyone makes mistakes, that decisions, are personal, and a case manager might not agree with a decision, but ultimately we support each client in whatever they're pursuing for their own goals. And we have an open door policy that clients can leave and they can come back, that our door is always open.
Which is so important. We talk about, and we use this term, trauma-informed. What does that really look like when we're talking about survivors of human trafficking? How do you meet their needs or serve them in a trauma-informed way?
I think one of the most important things when we think about trauma-informed care is letting the survivor lead the way, and knowing that they are an expert of their own, destiny, their own goals, and keeping that in mind throughout. One of the really important things that Hannah mentioned is that sometimes they may make a decision that the case manager, the service provider may not necessarily agree with, and being trauma-informed means knowing that, they know what is best for them in certain situations, and if we don't agree with it, it is not up to us to tell them what to do, but rather support them in what they're doing.
Right. And when you think, given the fact that it's a control element, these are individuals who have lost control in so many ways of their lives, it is important when being trauma informed to give them the ability to be self-determined and to make decisions, as you said, whether you agree with them or not. That is extremely an important part of this. I want to talk a little bit about COVID-19, which has literally turned everyone's life upside down. What impact has COVID-19 had on human trafficking? What are you seeing? Are there any differences now?
I think we're definitely seeing more referrals, that there's more need. People are are reaching out for help, and the capacity and the funding for our program has, we've definitely had some emergency funds, but overall, the funding that is needed to help with, I would say, the most important financial need, which would be housing, has not greatly increased. So we're seeing higher numbers, and then we're also seeing clients at Catholic Charities. A lot of our clients they do not have documentation. They're waiting for a T visa, asylum, SIJS, and during that time, they might not be eligible for some of this emergency rental assistance. So we've been trying to find other ways, and there are other funds depending on if they're in the District of Columbia, if they're outside in Prince George's or Montgomery County, where they are. So it's definitely depends on the county and where they're living. But overall, this need for rental assistance has really risen, and as the CDC guidance has expired and evictions might be increasing. I mean, we're going to see what happens. It seems like it changes every day. What's going to happen with some of the individuals we work with in their housing, and there's a lot of anxiety around that. And a lot of the individuals we're working with are going out and they're seeking work. They need to provide for their families themselves, and we've had quite a few clients who have gotten COVID, who have made it through, but also where to go for medical care if they don't have insurance, and how to navigate that, which is also, applies to the vaccine, and looking ahead for individuals who, might not get all the information or have the insurance to get coverage, is going to be really, really important as well. But at the same time, I think the good news is there have been incredible resources in the area for food and other necessities, and organizations have really stepped up and helped individuals in need get some of the necessities they need to keep going.
That is very encouraging to hear that resources are being made available despite some of the challenges that you mentioned. And you largely deal with the population, as you pointed out, oftentimes immigrants, more so than non-immigrants. At Fair Girls, that's not necessarily your primary population. What and how has COVID impacted younger women that you're serving there, and or men, I should say, as well?
Yeah, so one of the things that Hannah mentioned that I can definitely speak on as also being a challenge for our organization is the fact that while referrals are increasing, adequately being able to, help everyone that is in need of assistance has become a little bit difficult. And part of that is also internet access. Unfortunately, as we know, human trafficking affects those who are already in the most marginalized communities for the most part. While it can affect everyone, we know that members of impoverished communities and whatnot are at heightened risk. And unfortunately, there's that layer of them not always having internet access. So then it becomes a little more difficult to provide with the resources. And of course, we're working to have ends meet and whatnot. So we still work with them in whatever way we can, but there is that extra challenge. And when it comes to the younger folks, we work with Hope Court, which is a branch of the DC Superior Court, through which we help at-risk and or victimized youth. And one of the challenges there is that youth have felt very uncomfortable being on camera or having camera in their personal space during their hearings. So as you could imagine, that is going to be an extra layer of, challenge and fear for an already traumatized youth.
Absolutely. And, the other thing that comes to mind when, as was pointed out, and we all know that, so many people are struggling right now during this time, food insecurity, financial insecurity. The pandemic has literally created this panacea where people are just not even understanding how they're going to go from one day, 1 week, 1 month to the next, given the fact that we know relief has been, we don't know when relief is coming, but it's made for a very difficult situation for many. Survivors or victims of human trafficking are typically the most vulnerable. Oftentimes they are marginalized. They do have issues that put them in a place where they're in the world of trafficking for survival. Has the pandemic increased the numbers with regard to people who would have perhaps otherwise not fallen prey to trafficking, but due to the circumstances of a pandemic and all of the other things that come along with that? Are more people, have you seen more people coming into to you for services directly as a result of COVID? Either of you?
Yeah, and I think it'll be interesting to see what the data looks like in a year and what we can learn from this. But I think, we've been helping individuals, survivors of trafficking, apply for jobs and or education, whatever they can be doing during this time to further their career opportunities. And it's been really hard to get people into jobs. Like, they'll have a job one minute. I've had a client who's had like 3 different jobs over the past few months and has been laid off, each time. And then, talking through with her, when she feels like the only option is, going back to her pimp, like what other option does she have to support herself? And it's challenging because, the opportunities, especially now as we're in these winter months when the numbers are increasing so dramatically and businesses are closing, being able to help people stay afloat financially when the opportunities aren't really there. Does that answer your question?
Yes, it does, actually. Again, and as you pointed out, it's challenging right now. Have you seen any change with the dynamic of the population at Fairgirls, particularly as it pertains to COVID?
I would say that we've definitely seen re-victimization. So where, repeat clients coming back to us that were already kind of doing things on their own. So unfortunately, it seems like it's put folks, at a lot more strain and created challenges to where they may have been already leading the way and then, kind of like Hannah mentioned, end up either going back to pimp or being re-victimized by someone else. So unfortunately, that's also been a pattern for us. And we have also seen a rise of new clients coming in. Again, I think it's something that you mentioned earlier with, folks not really having the means to pay their rent, to know where their next meal is going to come from. And we know that traffickers are always on the lookout and very easily identify people's needs. So there is a rise. And I think that unfortunately it's going to be scary when we look at the numbers. But yeah.
Yeah, that's unfortunate. People, again, and I was one of those prior to working in this specific organization because I didn't do much around human trafficking. My background has largely been domestic violence. And I think, like many people, you wonder how could and would anyone allow themselves to become victimized, fall prey to a trafficker. There are so many misconceptions about what this means. And I think you said it earlier, Hannah, that anyone really could become a victim of trafficking. We just don't understand it enough. Are there any, very quickly, misconceptions that you'd like to help people understand about someone who has been victimized, who is living that life? Because again, as I said, educated, just thinking as a person, why would you? But when you really look at the dynamics and what has happened and why, and perhaps even people who are more vulnerable than others, just clear up for us a few of those misconceptions, if you will.
Well, I think often people have an idea that survivors of trafficking might be one group of people, might be girls or women who look a certain way. But what we know is that anyone can be, like what Jasmine mentioned, can be a victim of trafficking. And that's span socioeconomic status, education. We have, clients from around the world and who are also led to a trafficking situation, often out of desperation to feed their family, to help their family, to further their careers, but also societal, environmental factors. We also see that a lot of survivors, like we've been discussing so far, this is not the first time they're being victimized. That we see repeat victimization and discrimination towards these individuals because of their identity or a variety of factors. And I think it's important to also know that this group of people or survivors of trafficking are so incredibly resilient, and that their backgrounds, we've worked with individuals who have master's degrees, who are, highly educated. Just like the group of clients we work with, it really spans in terms of a diversity of factors, and that sort of how resilient and brave survivors of trafficking are to keep going, to push forward, and to keep moving on in their lives.
Yeah, and that is very real. Jasmine, is there anything that you would add to that with regard to misconceptions about this population?
Yeah, definitely. I think that, and it kind of relates to things you have both mentioned. A lot of the times people will find it very difficult to understand why survivors don't leave, or, people will think, okay, well, if they're being victimized and exploited, shouldn't they want to leave? But people don't understand is that, there's been a lot of grooming, psychological manipulation, and fear that's been ingrained by the trafficker. So sometimes, or, most of the time, it's very difficult for survivors to, one, even recognize that they're being victimized, and two, if they do recognize that they're being victimized, there's a large amount of fear because they may not realize that there's resources, or they may fear what this trafficker will do to them. They may have negative experiences with law enforcement or even service providers, and it may be difficult for them to reach out. So I think a lot of the times people fail to really take the time to think about and understand the barriers for survivors as they would try to leave the lives. So I would really encourage folks to look a little more into that, because I think that's one of the most common misconceptions that we see people having.
So as we wrap up this session, I just wanted to first and foremost, again, thank you all so much for the work that you're doing. It's vitally important. And, trafficking, as I've always said, is the new domestic violence, and that it's something that we don't hear a lot about, we don't talk about. I don't think the resources have reached the level that they have for survivors of domestic violence. So certainly we need to do more. But is there any takeaway, anything that you would like for viewers to know, even if it pertains to your agencies and needs as to where you are, or just something about this issue, how they can help, and tying it back to even being trauma informed? You're trained professionals and you understand what that looks like, but how could someone else who maybe doesn't have that background or real understanding be instrumental in not pushing someone away in a way that is trauma informed, and maybe they won't even use that word, but just something to help them?
Yeah, I think one of the most important takeaways that I hope folks leave with is that while this is a very complex issue and it can often be very difficult to hear about, learn about, I think that we all have power in the fact that we have a voice and we're able to keep spreading this knowledge. So, for everyone that watched this today, you now know a little more than you knew before, and you can go and tell the next person and the next person. So while, yes, this is a very complex issue and a lot of folks are being harmed, there's also a lot of us that are informing ourselves can continue informing ourselves and do something about it, as little as it may be, even if it's telling a few of your kids about it, telling your nephews about it. And there's a lot of resources that a lot of our organizations can happily provide. If you need any flyers or need help learning how you can talk to others about the issue. So just, remember that we have a voice, and while this is a large issue to tackle, we also have a lot of power as a collective.
That's great. Thank you. Hannah, any final words for you?
Yeah, I mean, to build off of that, this is, just an introduction to human trafficking and some of the work that we're doing for survivors.